Okay, it's 12:15, so we'll get going. My name is Dr. Melissa Stiles. I'm Director of Faculty Development for the department, and we're pleased to once again have a State of the Department forum led by Dr. Dave Rakel and the leadership team. Just a few housekeeping. If you have a question as the panelists speak, please just put it in the chat and we'll have plenty of time for questions at the end. The CME link is in the Outlook invite that was sent by Amanda Keenan, so you'll find it there. And there will be some poll everywhere questions during the presentation, and Matt will put the link in the chat, has put the link in the chat. So if you could get that set up, we would appreciate it. So without further ado, we very happy to have Dr. David Rakel and the leadership team present where we are, where we're going, and thanks so much. Dave, I'll let you take it from here.
Thank you, Melissa. Great to be able to do this after being here for a year, and just wanted to start with a deep bow of gratitude and being grateful to be able to be with you all and be part of you and to do some awesome work together. I'm going to keep me on time for 7 minutes, and each of the vice chairs and executive vice chairs are going to summarize the areas of their teams, and then we're going to weave it all together and hopefully weave a beautiful basket that we can hold this important work in. And so just a shout out to you all. To be number 5 in the country in family medicine and community health departments is just a wonderful thing that you all should be proud of. And this is a long historical investment that I think should make us proud. It certainly makes me proud to be invited into this department. I just wanted to share our structure and how we do things within the leadership team. We have Sherwin owns our project management tool, and the things on the top are projects that we want to be innovative in that make an impact, and so creating a faculty hub to make faculty's job easier and have a one-stop shop has been important. Enhancing engagement is something that we'll talk a little bit more about. Building a new department building is taking a lot of time that Jerome will talk about. And so I just wanted to show that we have specific structures in place to really help us define metrics that show that we're moving towards tipping the needle in making a difference for what our mission feels is important. The bottom area is tasks, and tasks are those things that we really want to support in regards to facilitating a consciousness in our department. So we've invested a lot in health equity and anti-racism, for example, and that's something that we always want to be giving our attention to. So that becomes part of our group consciousness. And so this is a little graphic that I put together in regards to who we want to be. You know, we want to be advocates for our patients, for ourselves, for the communities we serve. Our state of wellness is important to us, a sense of belonging, compassion, innovation, equity, DEI support. There's more than this, but this is who we are. And who we are needs to work through the lens of what we can uniquely achieve as a Department of Family Medicine and Community Health. And then we're going to take that consciousness, put it through this lens to really focus on areas that we want to achieve together, the work that we are uniquely able to do. And there are some things we've invested already over this last year, and one was engagement. And so we're moving the needle some on engagement. Our metrics are improving. The one in the checkered boxes is things we don't want to get higher. We want those to get lower. Everything else we want to get higher. And so this is an example of a project that we're working on where we have a strategy. So part of that strategy might be rise lunches and other things to engage folks. And then we have metrics to make sure that we are achieving that goal that we all believe in. These are a list of things that we've invested in over the past year. We've already hired some really awesome tenure track faculty. We have offers out to others, and we're excited to explore future. We've invested a lot in the Office of Community Health and excited to engage our communities and ask them how we can use our expertise in service of their best outcome. DEI, health equity. We're excited about the Enrich program, which is a program that we've invested in to recruit BIPOC and underrepresented minorities into family medicine. We started with medical students, and we hope to go to undergrad students. We're building a new home. We have a new fellowship. We're creating funding to create a little breadth for scholarship for our faculty to do things that they would love to do, even if no one paid them. We took time to create a strategic plan process. We invited 35 people from all parts of the department to help create a cognitive diverse group of people to help us define our mission and vision, and then help us define our strategies and goals into the future. And I won't read this to you. Maybe I'll read the vision real quickly. Our department is unified by bringing joy and compassion to our collective work in partnership with patients, families, and communities. We honor the histories of those around us while co-creating new ways of thriving. This is the work we want to do together. So based on that process of those strategic planning meetings, these are 5 areas that the group thought were really important. And we're going to sharpen the needle of the arrowhead here a little bit on what these will look like. But these are the general themes that we will probably invest in. They just may be defined a little bit differently. So defining the ideal primary care teams to deliver equitable healthcare in communities, enhancing connectedness within the department with a unified movement towards our mission. That's for faculty and staff, all of us. Increase interest and career choices in family medicine and community health through educational initiatives and engagement. That's our work is education and education towards family medicine and community health. Add joy and meaning to our collective work. How do we deal with some of these things like asynchronous care? How do we continue to maintain joy in the culture of our work environment? And then how do we grow value in healthcare payment structures by creating a better balance between reacting to disease and promoting healthy outcomes? All really important things as we transform healthcare for all. So I hope I didn't speak too fast, but that's just a little glimpse into what we've done in the past year and what we hope to do into the future. And Bill sends his regrets that he wasn't able to be here, but we're going to go through each of the vice chairs and executive vice chairs, and they're going to give us a little summary of their areas of focus and expertise in the communities that they lead. So we will start with Bill Schwab.
Greetings, it's Bill Schwab. I'm so sorry that I can't be with you for this excellent forum, but I'm very pleased to have this opportunity to talk to you about the great educational programs that are going on in our department from my perspective as Vice Chair for Education. When we talk about education in our department, we're talking about what's called undergraduate medical education, which is medical students, graduate medical education, which is residencies and fellows, and continuing medical education, which is our faculty development programs. Beginning with medical student education, did you know that our Family Medicine Interest Group, our FMIG, has been named a Program of Excellence by the American Academy of Family Physicians multiple times in the past decade? These programs are essential to stimulating interest in family medicine and maintaining that among our medical students. Did you know that medical students rate their family medicine education in our department over the last academic year substantially above national averages? And did you know that with mentorship from AMSA faculty, over 200 School of Medicine and Public Health students have matched into family medicine in the last 10 years? Those are great records of accomplishment, and congratulations to Mark Beamsley, to the other faculty in AMSA, and to his staff team for all that they do. Graduate medical education is residencies and fellowships, and we have a central GME office that is our sponsoring institution. Did you know that we, the DFMCH, are our own sponsoring institution for ACGME accredited residencies and fellowships. This is in contrast to all other residencies and fellowships in UW Health that are sponsored by the hospital. Instead, ours is sponsored by our department. And did you know that we collaborate as an academic department, as an academic partner with family medicine residency programs throughout the state? These are important educational alliances. I'm pleased to be able to work with a great group of people in our central GME office, and I'm grateful for them. Residency education is central to what we do in our department. And did you know that the Madison Family Medicine Residency Program is one of the largest and absolutely one of the best in the nation? We hear that from students, from residents, and from faculty colleagues around the country. Did you know that our highly regarded Baraboo Rural Track is a national leader and national model, one of the oldest rural tracks in the nation? And did you know that nearly 2/3 of the over 1,000 graduates of our Madison and Baraboo programs over the last 50+ years have stayed in Wisconsin? Think of all the medical care they have provided to our communities. Approximately 20 to 25% of those graduates have practiced in underserved areas. It takes a village and more to run a residency program. So great appreciation to Ildemar Tanfi, our program director, and the great team that works in our Madison and Baraboo residencies for all that they do. Osteopathic education is a core part of our graduate medical education activities. Did you know that our statewide Osteopathic Education Collaborative is a national educational model? And did you know that our OMT for the MD curriculum, which teaches manual medicine skills to those who have graduated from MD medical schools, not DO medical schools, that curriculum has been highly successful and has been adopted by other programs around the country? Our appreciation to Sarah James, our Director of Osteopathic Education, and her great team around the state for all that they have accomplished. And then there are our fellowship programs. Did you know that the Department of Family Medicine and Community Health is one of the family medicine departments in the nation with the largest numbers of fellows and fellowship programs? And did you know that our integrative health, addiction medicine, and LGBTQ+ health, as well as our primary care research fellowships, are among the first and, yes, the best, it's a theme, nationally in their areas of focus? Many thanks to Christina Swords, who is an outstanding coordinator of our fellowship programs, and to each of the directors of our fellowships. Melissa Stiles directs our academic fellowship, where graduates of our Madison residency program can remain for another year and focus on teaching skills, clinical areas of excellence, scholarly work, and leadership skills. Many have gone on to become faculty in our department. Our fellowship in addiction medicine enables its graduates to become board certified in addiction medicine so that they can be full-time practitioners of addiction medicine, or they can integrate that into their future primary care practices. Similarly, our integrative health program is a fellowship that can last for 1 or 2 years and enables its graduates to become full-time integrative health clinicians or to weave that into their future primary care practices. And our LGBTQ+ health fellowship is in its very first year. I'm pleased to be able to co-direct that. And it crosses all of the primary care specialties, so we do it in partnership with internal medicine and with pediatrics. We're in our first year. We have a great pair of fellows this year, and it is developing beautifully. Finally, our primary care research fellowship has been in place for decades, and we've had scores of PhDs and physicians who have completed it, have gone on to do great research and become faculty members all over the country. And finally, faculty development, led by Melissa Stiles, is another important element of our educational programs. What are our aspirations for the year ahead? Well, our Office of Medical Student Education will be increasing the duration a bit and amplifying the identity of family medicine within our Phase 2 CPC clerkship. And we're very excited about our new Enrich program, enhancing representation to improve our community's health, that has a focus on medical students who come from groups that are underrepresented in medicine in order to support their interest in future careers in family medicine and primary care and their success in their medical education. Our Graduate Medical Education Office is pleased to be welcoming the Monroe Rural Family Medicine Residency Program to our sponsoring institution beginning in July. Our residency programs in Madison and Baraboo are undergoing a substantial curriculum revision in response to the National Residency Review Committee of the ACGME that has done a large revision of the requirements for family medicine education to make it contemporary for the future. And our fellowship programs are each doing exciting things, but in particular, our new LGBTQ+ Health Fellowship is building on its first year, and we'll be continuing that over the following year. And our Integrative Health Fellowship is doing some very unique work, applying an equity lens to its curriculum as it renews that curriculum. And finally, our faculty development work is we're very pleased to be holding our statewide Faculty Development Day once again in person on April 4th, 2023. Faculty, please make note of that and save the date. It will be an outstanding program. And finally, did you know that we couldn't do what we do in education in our department without you? Whether you're in finance or IT, whether you're in our Office of Community Health or our Clinical Services section or our research programs, whether you're a faculty member in one of our teaching programs or you're one of the staff, we couldn't do what we do in education without you. So many thanks to everyone who's involved in education for the outstanding programs that we have in our department.
And I just wanted to introduce Jennifer Edgoose, who's our Executive Vice Chair. And we just heard this morning that she's going to be recognized by STFM as getting a national award for her work in diversity. So congratulations, Jennifer, and thank you for being an important leader in our department.
Thank you, Dave. So again, I am Jennifer Edgoose, and today I will share the community health, diversity, equity, inclusion, and anti-racism efforts happening across our department and plans for the upcoming year. So a privilege to be here with all of you. So for our Office of Community Health, this year has mainly been about building capacity, as we have 4 new members of our core team who were not in our department last December. So we hope you have met our Director of the Office of Community Health, Shelley Shaw, as well as our new Health Equity Coordinators, Maddie Batsley, Nazca Serrano, and Hazel Belling, as well as our new Research Scientist, Sarah Hole, and Jocelyn Eberly, our OCH Coordinator. As part of the onboarding of our new members, we have been engaged this year in team building and refined our OCH's mission statement, which is to braid together the wisdom of community partners, family physicians, and scholars in pursuit of health equity, and our vision, which is we will be a department that builds and sustains trusting partnerships between community partners, family physicians, and scholars to enable all to be thriving. We've also been developing strategic processes, both internally and externally facing, for our core team. So for example, as a team, we are working on a conflict resilience protocol so we can successfully not only mitigate, but also learn from tension within our own group. As an example of our external facing work, we've chosen to focus on supporting faculty who already have built trusting relationships with community partners or who have a strong interest in doing so. And as a developing team, we've had the privilege of working with and supporting many faculty and scientists across our department this year. So these are a few of them. So our strategic areas of focus are partner engagement, education, research and evaluation, workforce development, advocacy, and we hope soon to be doing more around communication and narrative building. This upcoming year, we hope to shift from going wide to going deep. So we established the necessary preconditions for deep departmental community partnerships. Foremost, we hope to center on community priorities and capitalize upon already developed trusting relationships. Projects should have data and evidence, the right partners or stakeholders at the table, an evaluation plan, application of an equity lens, and a plan for sustainability. As an example, we are focusing on research in rural Southwest Wisconsin alongside Jillian Landak. Hazel and Sarah are interviewing stakeholders to develop a model of trusting partnerships to be applied in our OCH work at large. We also are supporting John Tempty as his team finishes analysis of interviews of rural public health officers in Wisconsin and their experience with the pandemic. For minoritized communities, NASCA is building capacity and elevating collective power among Dane County community health workers alongside Jonas Lee through a CDC grant. Maddie is focusing on advocacy for LGBTQ+ populations, supporting Dr. Ronnie Hayone. Maddie is also advising UW Health on equity in recruitment for patient and family advisory councils and collaborating with the Center for Patient Partnerships to develop an LGBTQ+ health law clinic. For our DEI work, our department is soon to start the third year of our anti-racism initiative, and our work has attracted attention not only locally, but also nationally. So this is a recording that's available on our departmental diversity webpage, featuring a presentation given at this year's STFM annual conference, as well as last month's UW Diversity Summit. And these are the wonderful members of our DEI committee who are happy to answer questions you may have, as well as members of the NINA Collective who've been consulting with our department now for 2 years, supporting our anti-racism efforts. Our team recognizes that there are many levels of DEI, from the individual level to the institutional and policy level, in order to really move forward toward becoming a multicultural anti-racist department, which is shown in this paper that was just published a few weeks ago by Lashika Yogendran at the Northport Clinic and myself, as well as other national leaders. So this shows some of the specific work happening in our department on an individual level, includes providing a lot of training opportunities, and I do encourage you to please sign up for the 10-week Black History course led by Justified Anger of the Nehemiah Center that is being offered right now by our department. On an interpersonal level, some of you are participating in racial affinity caucusing, and if you are, please submit your evaluation, which we're working on now. On a community level, beyond work of the Office of Community Health, I'd also like to highlight, as Dave did, the Enriched Mentorship Pathway Program for URM students, which is led by Patricia Teez, Tom Hahn, Morgan White, and Estefan Beltran. And the Health Equity Work Group on Scholarship, or the Hughes Group, which was spearheaded by KJ Hansman, Edmund Ramley, and Serena Schrager. On a policy level, ask Sheena Friedrich about the transformational work happening in human resources around recruitment and our DEI committee, who's been providing guidance to promote cultural and religious inclusivity. So as we look to the new year, we hope to further cultivate our community partnerships, certainly evaluate our success at developing trusting partnerships. We'll continue to offer ongoing DEI and anti-racism programming and NINA coaching sessions, and we will be piloting something called Health Equity Rounds. This is something we're hoping that Morgan White and Yohali Anaya will be leading and offering this later this spring. We're also planning to launch a community health and Hughes learning collaboratives. There'll be both of them. They'll be launched this upcoming year. And our Office of Community Health will be supporting development of a community advisory board for our department. So thank you.
Thank you, Jennifer. And as Randy Brown puts his slides up, we're so lucky to have Dr. Brown in our department. I can seriously and authentically say he's a worldwide leader in addiction care and research, and he's our interim vice chair for research while Bruce Barrett is on sabbatical. Randy.
All right, thanks a lot, David, and thanks for having me here. Standing in for our esteemed leader, Bruce Barrett, who's on sabbatical developing a new investigational area for him along the line of eco-wellness and sort of interaction between person and environment and how that can impact health. So be excited to hear about that as he gets back to the helm here in January. And I want to report out on some of the goings on in research, a lot of wonderful people doing exciting and important work to move the vision forward for the department with some goals, perhaps obvious, to continue increasing our research funding and dissemination of results, but also, you know, having more an eye to participation of our communities and clinics, and really being mindful of that. And that's something that federal funders are encouraging to do, and specifically calling out the extent to which we have interacted with key stakeholders and community members as we formulate our research ideas and our plans. And so I'd put that out there as a seed to you all as well. If you're having experiences in your own work and clinical practices, seeing areas of importance that feel like they require some attention, you know, we appreciate that feedback from folks so we can continue in these lines and remain one of the leading research departments of family medicine in the country. I made mention of some of the wonderful people, and there's several more than you see here, but these are our current tenure track of faculty in the department. And in exciting news this month, Andrew Quanbeck was reviewed by the Biological Sciences Divisional Committee and just granted tenure and promotion to associate professor. So really excited for him. He's been doing some really impactful work in the area of implementation science, enhancing implementation of best practices, and collaboration and work around mobile health applications to facilitate self-care with a number of chronic illnesses, including substance-related issues. But there's a large list of others that are contributing really significantly to scholarly work in the department. And I wish we had more time to unpack some of this, because as I've talked to people about their work, I'm really excited about the things that are happening in the department, including, I made mention of mobile health to support behavior change, investigations into behavioral health intervention to improve function and well-being for individuals with chronic pain. In other work by Dr. Duffy that's quite interesting and important, he's interfacing with mobile health and community health workers in Guatemala to facilitate self-care with diabetes. Work by Earlise Ward in behavioral health and access for African American populations, and a whole list of other really exciting projects going on, and encourage you to check out these investigators on our site to learn a little more about their work. Here in the interim, when Dr. Barrett is on sabbatical, Dr. Earlise Ward has been at the helm with the research fellowship in the department. So I'm going to pass the baton to her here to talk a little about that effort.
Thank you, Randy, for the opportunity. I will just briefly mention that we currently have 7 postdoctoral fellows who are doing outstanding work, and we recently interviewed 3 that will then replace the ones that are outgoing. So we're just really excited about bringing in a new cadre as well. So our current fellows, we have Dr. Tana Chunsuwat, who is a family medicine physician. She's finishing up her 3rd year. We have Julie Kirsch, a nurse with a concentration in, I'm sorry, she's not a nurse, she's a psychologist. She's actually finishing up her 2nd year. And we have Jane Everett, who is a nurse, and she's finishing her 2nd year. She's been very actively involved with the Qualitative and Health Experience Research Lab, one of the exciting projects she has going on now is that they've done a series of interviews that they've now turned into films to really share the experiences of people who have gone through smoking cessation, who are living with cancer, so cancer survivorship, long-term COVID, as well as experiences of cancer care providers. So very interesting research going on here by Jane. We also have Asma Ali, who is also second year and PhD in pharmacy. She shared with me that her research goal is to facilitate safe Ramadan fasting for Muslim patients who are diagnosed with chronic conditions. Particularly, she's focusing on people with diabetes to really improve health outcomes as they engage in their religious practices. Next slide, please. These are our three most recent fellows. So we have Justin Williams, a PhD in public health. And Justin is particularly interested in HIV infection among African American women who are sexually engaged with African American men who've been recently released from prison. We also have David Mullinson, first year, PhD in population health sciences, and Taylor Watterson, PhD in pharmacy. She is a first year fellow and is doing research that is examining how health information technology can improve communication between pharmacies, primary care providers, and their patients. So that was just a brief summary of some of the research that is currently going on with our fellows, but very engaged, doing awesome work, and we're really proud and excited to have them on board. We just finished up our research fellows symposium 2 weeks ago. We have another one that will be coming up May of next year, so I'm putting out an early invitation to say, please join us and learn more about our fellows and the important work that they are doing. Thank you.
Thanks a lot, Elise.
Yeah.
I'm just putting this up briefly by way of demonstrating the variety of investigators in the department and staff that make all this work possible, and want to talk a little bit about the support that's available in the department. We have an outstanding research core team that really does a lot of heavy lifting to make sure that research is going well in the department. As you know, Bruce Barrett, our research vice chair, Lisa Sampson, who serves as his dyad and provides leadership guidance to the research program overall. Denise Runyon is an invaluable resource when it comes to grant funding for research. Mary Chekovich fairly recently moved into a role as regulatory specialist and is an encyclopedic resource for regulatory requirements, IRB issues, things along those lines. Shouts out also to Rakel Lundwall for her support with research writing, and Nathaniel Javid for all his support with administrative responsibilities with the research core team. Another recent addition to the team has been Kate Judge, who is here to help primarily CHS track faculty navigate department and university resources in order to engage in scholarly work. So encourage those of you listening on CHS to reach out to her with your ideas, and she can connect you with the rest of us or other appropriate resources to move that work forward. And just a few numbers on the department. Made mention of the fact that we're one of the largest, most productive research departments in family medicine in the country, and these are a few numbers to that effect. You can see the variety of awards and funding that's coming through the department of late. And these are just some of the teams that I'd encourage you to search up on our department website and see what exciting activities are going on beyond those that we've been able to touch base on today. And thanks again for the opportunity, and I'll pass it back to you, David.
Thank you, Randy, for that beautiful review and summary. Next is Russ Lemon. Really excited to have Russ in the role as Vice Chair of Clinical Services, and he has just a fantastic team of service chiefs, Matt Swedland and Jamie Kling and Trish McCormick and Jen Lochner. So welcome, Russ.
Thanks, Dave. I really appreciate it. Yeah, and thanks to Melissa for coordinating. I appreciate the chance to be with you all. It is a tall order, I will say, to try to summarize all of the work happening clinically across the breadth of what we do in our department. So I thought I would try to capture that a bit, just with a few numbers. So across our 17 clinics, we have over 160,000 medically homed patients and over 1 million clinic visits, MyChart encounters, telephone encounters. So over 1 million touches with our patient panel over the course of the last year, and the year's not even done. And that doesn't even include work happening in 2 urgent care sites by family physicians and APPs and across the multitude of hospitals in our Dane County and regional hospitals where we have faculty members and APPs working. So just absolute boatload of clinical care happening across our region, really just showing that all of you really are caring for your community. And I was thinking about trying to summarize the last year. Again, it's been another year, right? To do all that care, you had to navigate all of these viral surges. Yet again, I looked back to what was going on in January, and we were dealing with a pretty significant Omicron surge. And the viruses change, but they just keep coming. But you've navigated it all. Think about all of that we've done to promote and include vaccines, COVID vaccines specifically into our clinics. That process went very smooth in integrating that into our across our clinical environments, thanks to all of our teams in doing that. If you think back to the beginning of the year, we didn't even have processes to get COVID therapeutics to our patients, which we do on a pretty frequent basis now. Again, not saying in any way that's a perfect process, but it's certainly important to our patients, and it's all of you put a lot of work into that. We've also had to navigate things that are completely beyond our control. So with major changes in reproductive health care nationally, you've helped each other and our patients navigate all of that. We've had clinician shortages in many areas, especially urgent care, and many of our clinicians have stepped up to try to help out in whatever way that they can. And I'll tell you, the thing that inspires me more than anything is just looking at all of the ways that you all take care of one another, whether that be a dance party at 3 p.m. Or a dress-up day, or having fun at Halloween, or just trying to cover for someone when their kid is sick. It just happens every day all over our clinics. And our patients notice. So I just tried to take a small snapshot. And this is a tiny snapshot. It took me about 5 minutes to find these comments for our patients. And just across all of our clinical sites and clinicians and teams, our patients keep coming back to you because you do a phenomenal job taking care of them. That's the bottom line. The other thing you've been doing is navigating leadership transitions. Dave mentioned that there is a great team working to support you, and I'll tell you of the things that I'm most excited about in the year to come. That is the biggest one. These are a few of the individuals I have the privilege of working with on a pretty regular basis. That their job and is to support you all in our clinical world, and I can tell you that they are all very passionate at doing that. So with our new service chief team of Jamie, Trisha, Matt, and Jen, they're really I can't say enough about how much they're trying to support all of you and are really doing a phenomenal job. And then including Jill Haase as our APP supervisor, who is really working hard to support our APP team and ILD for the residents. And I'll also include Alicia Rizzo, who's the UW Health Primary Care Director in this. The only reason that she's not up here is I couldn't find her picture. But that rounds out the team that's really working hard to support you. So moving to next year, I really wanted to acknowledge that, yeah, there's challenges. We've got stuff to do. I thought it'd be insincere not to mention that. I heard James Bigham use the phrase keeping it real recently, and I thought that applied here. So I included it. So keeping it real, we know that there's challenges in trying to take care of the patients that we serve in the ways that we want to do that. Whether it be the amount of work per patient that seems to be going up, or patients not being able to access you, which has all kinds of downstream consequences, staff shortages that are nationally getting worse, unfortunately, not better, and health equity outcomes that we know are not going, are not where we want them to be yet, at least. But we're, in addition to working on those and ways that we're working on those, there's a lot of actually really exciting things planned for our primary care group at large and for us locally in our clinics and department. So across UW Health Primary Care strategic planning is being rebooted by our very own Kirsten Reinflesch over the next year. It's a really exciting time to actually imagine what our teams of the future should look like in taking care of our patients and our communities. UW Health is implementing a new structure for compensation for physicians, which is termed the XYZ structure that you may have heard. You're going to be hearing a lot more about that in the next few months. This is actually a great time for that because it allows, similar to primary care strategic planning, allows us to really think about, are we best aligning incentives in the ways that we're trying to support the outcomes that we want? So just really two big important projects that are happening that will really rely on all of your input and making those successful. And although I'm quite excited for those big projects, we know that it takes a long time to get a big project moving. So we need to do some things to move the needle now, and I think we can. We know there's really innovative things that are happening across our clinics, and we really have the intent of trying to capture that work and spread successful projects to benefit more of our clinics and teams. We're working hard on trying to develop frameworks to address some of these challenges that we have for access, and really looking to find new ways to support you all as teams. So just a incredibly short list because we know that there will be things that try to knock us off this list with things out of our control all the time, but I'm really excited about the things that we are going to be talking about and working on, and really excited about the team that's supporting you all. That's what I've got. Thanks, Dave.
Thank you, Russ. And last but not least, someone I'm just so grateful to be able to work with and learn from, our Chief Operating Officer. Is that right? Is that the right title, Jerome? No longer Department Administrator, Jerome Garrett.
Just good afternoon, everyone. Thank you for taking a moment just to provide some administrative highlights for 2022 for the department. But before I do that, I just want to extend my gratitude and acknowledgement to all of the teams that really move this department forward administratively, from our colleagues in finance to IT, communications, as well as project management, and all of our team members in the office of the chair. And then all of our colleagues throughout each of the service areas. Really appreciate all the hard work and things that you have done to really move our department forward. just want to highlight a few accomplishments that we had administratively that I feel really have supported the department to again move those missions forward. First, we've had the opportunity to invest in our staff in an amount that I'll share with in a moment. We also had the opportunity to expand our teams administratively to really allow for more bandwidth to support all of the work that we do throughout the department. And then lastly, we had the opportunity to land on a selection of our new administrative home or hub or clubhouse, whatever you want to call it, at 610 Whitney Way, and then also start the construction process, which we hope that will conclude sometime in February. So as I mentioned, we had the opportunity to invest in our staff. You know, again, I'm newer to the organization, but one of the things that I'm learning is that central fund initiatives don't happen twice in 1 year. And that actually happened. And so these are just 4 pay initiatives that happened within this calendar year, starting back in January, where we were able to invest $137,000 from the pay plan. And then we had the fiscal year 22 discretionary compensation fund of $133,000 that was effective in January and was paid in February. And then most recently, we had our fiscal 23 central fund initiatives with another round of DCF and performance bonus fund. And all of those together throughout this calendar year, we've been able to invest $1 million, over $1 million in our staff. And that does not include the forthcoming pay plan that's coming next month in January of $204,000. And again, just to give you a snapshot of just our financial budget that we submitted back fiscal year 23. Again, we operate over a $71 million budget. And again, we're actually in the process of starting the budget process for fiscal year 24. This month, we have launched that and we'll continue those efforts. Just want to elaborate on the expansion of the administrative team and why we decided to invest in that team and really look at those roles. Get some of the feedback that I received in my time here assessing the landscape is that people were experiencing or expressed being overwhelmed and with some of the workload that we were doing. There was a recognition that when I look at my colleagues in other clinical departments that administratively lean compared to our peers. There's also limited bandwidth to conduct some of the work that was mentioned earlier with some of the strategic projects, as well as a previous administrative support structure really limited the ability for some of our faculty leaders and others to really use their time administratively and strategically as well. And so what we were able to do was add a number of new positions to our department admin structure that would allow us to increase bandwidth and to really create a new steady state of operation, really allow for folks to absorb more strategic work and then increase bandwidth for our faculty. And so this is the list of the actual positions that we added within the fiscal year 23 budget, and just a brief description of the positions as well as the role and when the target times that we were hired. And I'm happy to report that we were able to fill all of these roles within the calendar year. And this is just a high-level outline of the structure of each of the roles. And one of the things that we did make a switch to is within our clinical mission, we were able to convert that role from, or I would say hire that person on our UW platform to really align the positions across the board. So now each of our missions have a administrative specialist that will support them. And Monica Bachman will be joining the team in early January to support the clinical mission. And then as far as in the office of chair, we had the opportunity to hire a great talent coming from the school district and with some background in Madison College, Judith Castro Romaker. She will be the administrative manager that will lead the team you see below with Sarah, Sue, Alice, and Jen to really provide, again, that depth and support to move things forward administratively within the office of the chair. And then lastly, we've been able to, again, complete that RFP process and select a site. And so again, through that process, we were able to convene a committee to help with the design of the space back in April, and then really start the process of getting ready to move back in the spring, of beginning to review all the items that we have in offices, do some spring cleaning, and then at the same time begin construction process with that new site, where we were in the spring also got approval to build, as well as began construction in August. Right now, we're in the process of, we're at the point where we're installing dirt walls and furniture systems, and we hope to have to that occupancy permit to be able to move in February 17th to begin that moving process towards the latter part of February, with the target lease of March 1st. And here are just a few of the pictures of this new space as it is still currently under construction. So what you're seeing here is just a picture of, on the left side, of kind of the area where you see the patio and a future break area for the new space. And then on the right side, you see kind of the back area, the break area, and then looking front into the multi-purpose room, where there'll be a partition wall that will separate the two and open up as needed if we need more space. And then these are just more spaces of small conference rooms. These are 2 small conference rooms that will be divided also by a partition wall for use. And then this is right now just the open area in which this is before the dirt wall systems and the walls are installed within the space. And then another on the right, you see a example of another small conference room. The other thing I just want to note is that we will continue to maintain a presence here at St. Mary's, and so our education team right now we're in the process of negotiating space on the first floor to be able to renovate the space with similar themes and concepts that we're doing within 610 Whitney Way, to really have space for them to have conference rooms, multi-purpose break, and really be able to again utilize some of those spaces and conference rooms that are available on the first floor to support the education administrative team.
Thank you, Jerome. And I know our time is running short. I was hoping just to get people's engagement a little bit here. So if it's okay, click on that poll everywhere link. And Matt, will you tell people what they need to do to answer this?
Yeah, there should be a in the link in the chat, the pollev.com/DFM1100. And I might need to make, there you go. Just enter your answer.
Yeah, so this is our goals for the next year and beyond, probably a good 5-year goal. And these came out of our strategic planning retreat. And just one more bit of data to give us guidance on what you feel are the most important areas for our investment. We'll give you some time to click on those. While people are answering that, I just was just filled with pride in listening to all the vice chairs and executive vice chairs summarize all the good work that you're all doing. And I just remember the chair's office works for you, and we need good information and good transparency and good communication to understand how we can succeed in working towards our collective mission. So that being said, we will continue to work on enhancing connectedness, support, and mentorship and sponsorship for the department. That looks like an important area, as does joy and ease of practice. And so we will keep sharpening the needle on how to best create innovation that will have the biggest impact. So let's, looking at the clock, Matt, why don't we go on to the next question? We got 2 more. The next 2 are word clouds. So what are our gaps? What did we miss on the strategic planning process that you feel are really important, if you could share in one word? Time, community health workers. Time and wellness. Community. Balance, support. Volume. I'm assuming that's better volume. Support, development, acknowledgement, engagement, job security. Staff. Beautiful. Equity. Advocacy. Access. Great. Wonderful. Thank you. And one last one, Matt, one word describing what you love most about our department. We'll end with the positive. Yep. We'll take people even with an I. Yeah, it's each other. It's the people. Our most valuable asset is each other. So thank you for that. And that's a good one to end on right there. People right in the middle. Thanks, Matt. I know it's always challenging doing Q&A in about 3 minutes, but if there are any questions, Melissa, I'll let you organize that from here out.
I don't see any specifically in the chat, but please, if you have a question, go ahead and put it in the chat. I think one question I have, Dave, is, kind of next steps in terms of the strategic plan, and if specifically people wanted to get involved in one of the focus areas, what kind of avenue will they have for that?
Yeah, thank you. So we're working with Darren Harris, who's our consultant, to help with our strategic planning, and our next job is to focus our goals. And then once we have our goals, we're going to develop strategy. And the perfect world is that the strategy will affect multiple goals. And so we will message those goals. And remember, we can't have too many. But these are things that we really want to be innovative and impactful around. And we had a beautiful discussion this morning, and Jennifer talked about the importance of innovation, and Darren and Sherwin and Jerome talked about the importance of impact. We want both of those things. And then how do we continue to invest in the consciousness of our department, of our culture? And those are things that we will never stop working on, health equity being one of those. So we're halfway through the process. So as we develop these goals and strategies and metrics, we will invite folks to better inform us and collaborate, and we're going to need everybody.
Great. And yeah, a question for Jennifer. As the Office of Community Health has expanded, how, if people have a interest, they're involved in community partnerships, how best to link with you and the Office of Community Health?
Yeah, I would be happy for anyone to reach out to me. And like I said, we should be launching soon our a family medicine learning collaborative for community health. And I think that will be a really great space to bring together folks across the department who are doing community engaged work. So yeah, but look forward to seeing some emails come my way. Thanks.
Great. Well, thanks everyone for joining. Thank you very much, Rakel, the whole team. That was a really wonderful presentation. Always excited about our department. So this is a great way to end the year. I just also wanted to acknowledge Amanda Keenan and Matt Fleming for helping to organize this. A lot of moving parts, so thank you very much. And along with value-based care, our next forum is going to be focused on primary care investment. And so that's going to be January 11th, should be very good. Dr. Wayne Eltman from Tufts will be joining us for that. So have a good rest of your day. Thanks for joining, and goodbye, everybody.